Hi, everyone. I will be presenting tonight on the seizure management in children. And present. There we go. All right. So what is it? So children with neurological diseases frequently experience acute seizures. So the majority of seizures are short-lived, so that just means lasting less than 5 minutes, but there are prolonged seizures that are defined as lasting more than 5 minutes. These are the more serious ones, the ones that last more than 5 minutes. Not every child is going to need treatment for seizures, but particularly if it's just one seizure and then they don't have another one, or if they get imaging such as MRIs or other kind of imagings done and everything looks normal. But if the seizures reoccur, then they will need to be treated. So let's talk about the treatments. So the first treatment is medication. This is a way to treat seizures in kids. So it begins by giving them a low dosage. And let me make this white so you can see it better. There we go. So low dosage. And also we would want it, it may keep increasing until they no longer have the seizures. Also, something that's important is the child giving medication to children is frequently going to change because the child, as they grow older, they may not need it as much. So meds need to be adjusted as the child grows. So there are some, side effects to medication and some contraindications. So there might be interactions with other medications. They may have an allergic reaction. They may have other different side effects. So the side effects can be, make them feel sick or lethargic. And then the child would be on this medication. They would continue this medication for 2 years. And then if they have no seizure within those 2 years, then they can stop the medication. Now, when a child stops their seizure medication, it would want to be slowly stop. Do not suddenly stop. So that is one treatment approach to seizures. So another treatment approach to seizures are the keto diet. And particularly why the research is high on the keto diet is because it reduces the amount of carbohydrates you are eating. So this keto diet is high fat, low carbs, and adequate protein. It's not a cure, but it lowers the seizures by 50%. Studies have shown. So it seems to be a very good thing to do for people that might have seizures. This is also something that a parent shouldn't just start with their child. It needs to be monitored by a dietitian and the other professionals. And same thing with medication. As the child grows, things might need to be adjusted. So they're getting the adequate nutrition they need. All right, so that's dietary. The last two I put under other. We have the vagus nerve stimulation and brain injury. So we're going to start with the vagus nerve stimulation. So this is the vagus nerves are large nerves in the neck. So this is providing electrical pulses to those vagus nerves. And this would mean that the child would need a small device implanted or pacemaker for those electric pulses. Same thing as the dietary, there's been studies done on this, and studies show a decrease in seizures by 50%. So it's something that seems to be pretty effective. And then the last thing is if medication is trialed and doesn't work, then you would want to look into, they can do a brain surgery, and they can also that it's only if it's persistent and frequent seizures that we would want to look at the brain surgery option. All right, so let's move on. Let me clear all this. All right, so then the next thing I put here, this is from one of my references, and I put that reference down at the bottom, but this is what you do if you witness a child's seizure. So the most important thing is preventing the child from doing harm. So I'll read quickly through this. So you want to place them on their side and keep their throat clear. And they might have saliva or vomiting, so putting them in a side-lying position will help that, so they do not choke. Don't try to stop the movements. Don't put anything in the child's mouth. If it is not possible to swallow the tongue, so do not try to put something in their mouth. Keep an eye on the clock so that you can see how long the seizure is going for, because usually they're about 3 to 5 minutes, but after that, then they require immediate treatment. Move child away from potential hazards. You don't want them knocking their head on something, so take all the furniture and things away from them. Stay with the child until the seizure ends. So don't obviously leave the child there. Discuss post-seizure plans with the healthcare professional, and then also call for help or call for an ambulance in the situation of it lasts more than 3 to 5 minutes. If the child is injured while when the seizure happens, if the child has difficulty breathing or the skin is blue, and if the seizure occurs immediately, or if another one occurs immediately after, or if the child cannot be aroused after the seizure. So here are some other considerations. So we need to avoid biking, skating, skateboarding, or any kind of extraneous activities on heavy traffic, on streets with heavy traffic. Climbing should be avoided. and limited, because if a child has a seizure while climbing, there might be a potential for a serious fall, and that can result in a TBI or more issues. Always supervise the child around water, and this includes baths. So I'm just going to write baths over here. That also includes baths. So not only just swimming pools and oceans and that sort of thing, lakes, all that, but also in the bathtub if they're taking a bath. Because if the child has a seizure while in the water, it could potentially mean that they are drowned or they put water in their mouth and in their lungs. So the child should wear a medical identification bracelet or necklace at all times, just so that if you are not with the parent is not with the child, or if the child's not able to communicate what is happening, that they are aware, the people that are around the child when it happens. It's important to make sure the child gets adequate sleep and that they take their medications on time. So the parent, it's really important for the parent to be able, if the child's too young, to give those medications on time. And then also, if they're older, just stress the importance of it. So they need to be cautious when driving. If they get older into 15, 16-year-olds, they need to be cautious when they're driving. If they have a seizure when they are driving, it could revolve in a motor vehicle accident. And then there's an increased risk of seizures with alcohol and recreational drugs. So make sure that you stress this importance to the child as they get older, that if they're still living with seizure activity, that they refrain from alcohol and recreational drugs. All right, and then here are my references. And thank you so much for listening.